It's a beautiful day in the gayborhood, a beautiful day to ask a gay doc with Dr. Renzo Corzano of Desert Oasis Healthcare. And originally, what were we going to do this week?
We were going to talk about boner pills
Yeah, we were.
with
Yeah, we're going to talk about the over-the-counter supplements that you find that are near the checkout at many gay establishments.
yes.
But then the World Health Organization made a big news-making announcement, and tell us what was announced.
They've declared a new global health emergency for MPOX. I think this one's going to be a little bit different than what we saw 2 years ago.
So there is a new outbreak, and this is
Yes.
happening in Africa right now.
Yes. So the one thing I'll say is like they actually renamed it to MPOX because they didn't want to be like, monkeypox.
Yeah.
So we have to call it MPOX now as of like 2022. MPOX actually has two different variants. Okay. There's like clade 1 and like clade 2. Clade 1 tends to be a little bit more aggressive and people actually can die from it. Okay. And so let's talk about that because, like we said, like the WHO declared this global health emergency, and that was actually for clade 1 monkeypox.
Okay.
And since the beginning of this year, and this is all like clade 1 data, okay, it's a deadlier strain of the virus. There's been about 17,000 cases in Africa, okay, about 500 deaths. Clade 1 outbreaks in the past have been known to kill about 10% of people who got sick.
Wow.
Yeah. Now that's on the higher end. Okay. So these are just like isolated outbreaks that they've had, and it was clade 1, and they've known to kind of, get that many people. Sweden confirmed the first case of MPOX outside of Africa. And this person was infected while they were visiting Africa. And it's actually been confirmed to be a clade 1 MPOX infection. That could be isolated, maybe somebody traveled. But this is kind of how this thing started last year.
There was almost a patient zero, but you could connect the dots of where
Right.
people made, because this is skin to skin contact. It's the same
Yes,
kind of transmission from the
it
mpox we
is.
had.
Yes, close contact. But apparently you can also get this if you come in contact with like contaminated linen.
Hmm.
Yeah. So, there's a couple modes of transmission, but that's kind of the worry, right? I mean, we saw the same thing with that trichophyton fungus that we talked about last time. It's like it's just kind of localized to these like areas in Southeast Asia, and then boom, somebody takes it and then it goes, to another place. So this is kind of why we're talking about this because we travel a lot and sexual partners and all this stuff. And so I think I just want to reiterate, man, that we really need to be vaccinated for this because so far, like we're basically saying that the vaccines are kind of helping prevent this, and or if you do get it, it's going to be like a very mild case. And so, like we talked about last time, I think it's time to get everyone vaccinated for this. The vaccines are available. People should just be asking for them.
Do we need boosters if we had the double mpox vaccine, and is the one that we had 2 years ago durable?
Yeah, it should. I mean, after 2 doses, like breakthrough infections are rare. They're like less than 1%. Okay. And if you do end up getting an outbreak, it's actually associated with like less severe infections.
What is actually killing people?
So there is fatality with the other one as well. But so people usually when they get monkeypox, what ends up killing them is actually complications from the monkeypox, which could be pneumonia, brain infections, which are called encephalitis, or even like eye infections. So that's kind of when it becomes, deadly. Okay. So those are more common with a clade 1 than there were with a clade 2.
So if people are presenting with these symptoms, what should you do?
Well, let your doctor know. But the symptom management is mostly like conservative treatment, right? We just kind of treat the pain and all that. But usually, I know there's an inhibitor that people can use, but I don't think it's really widely available.
So the vaccine can prevent, but it's not a cure to the thing running its own course.
Right.
And how long is the course that it has to run?
Usually about 3 weeks. So the way that it kind of presents itself before you even get the rash, you kind of get like flu-like symptoms, fever, chills, muscle pain, headaches. Then you might see some like swelling of your lymph nodes. And then you see like the widespread rash. And then the lesions usually like kind of scab off, but it can take like 2 to 3 weeks for it to completely heal. So during that time, you kind of want to isolate, not be touching people right now, it's not exposing people to all that. These lesions, depending on kind of where they are, can be very painful, especially in the mouth or like your anus or your penis, like vaginas, all that stuff. It can be very painful. So we usually kind of treat the pain. For very, very severe cases, like I said, there are some medications that you can use, but I mean, I've never used them. I've never prescribed them. So yeah.
So, and it will be scarring, most likely.
Yeah, most of the time there's a little bit of scarring. It really kind of depends how aggressive you are. While they're erupting, if you're like constantly scratching at them, it's more likely that it'll scar. Kind of like chickenpox.
This is a WHO World Health Emergency, and they don't do that lightly. That doesn't happen very often.
They do not. No, I mean the last time they did it with MPOX was, like I said, in 2022, and that lasted almost a year.
And
So
I think our community did a pretty good job with that.
I think so too. I mean, people were really seeking out vaccines, but I would get it done as soon as possible if you haven't been vaccinated, because I'm sure there's a stash somewhere that you can actually access instead of having to wait, for the vaccine once, if this, becomes a more widespread problem.
And of course, you can ask a gay doc by sending your questions to LGBTQ health at mydohc.com. We'll answer those anonymously. And we really appreciate you, Dr. Renzo Corzano. Thanks for getting us up to speed on a major story worldwide that could affect us here in the Valley.
Anytime, man. And next time we'll talk about the boner pills.
Okay, next time it'll be over the counter erectile dysfunction remedies.
Be safe, everyone, and get vaccinated, please.